Hello friends, welcome to SHREE NETRALAYA. Here I am going to show you a case of small pupil due to a posterior synechaie. Patient has a history of uveitis few months back, following which the pupil is not dilating fully. So we have a situation of a small pupil nearly 3 millimeters. You can notice a festoon pupil due to posterior synechaie. Please do notice the initial steps of surgery, as these initial steps are crucial in deciding the course of surgery. Main port 2.6 mm and 23 gauge side port incision is made, following which injection of adrenaline is tried to dilate this pupil and synechaiolysis is done with same cannula. You can try a pharmacological dilatation, a mechanical dilatation, or a viscodilatation in such cases. All these maneuvers will help a bit at different stages of a surgery. Staining of anterior capsule is very important and it should be done even under the iris. You can just lift a part of iris and stain the capsule even below the iris. It is crucial to stain the capsule below iris, as that will give a better visibility while performing rhexis. Additionally, a stained capsule is less likely to have chances for extension, and in cases of small pupil where the extension of capsular rhexis can occur below iris, which is invisible, the chances for extension is more if the capsule is not stained and less if the capsule is stained, in my personal experience. The pupil here is hardly 3 to 3.5 mm. I am supposed to do a rhexis which is around 5.5 to 6 mm larger in size, as that will help me in manipulating the nucleus during phaco emulsification. You can place anterior capsular flap after rhexis on corneal surface and measure the diameter of rhexis you have created. Performing hydrodissection and hydrodelineation is of crucial importance in cases of small pupil. You can do a hydrodissection at multiple points and rotate the nucleus. Try to avoid overfilling the chamber with excess amount of viscoelastic, which will push the iris through main port or through the side port. Place your left hand first in the AC, then go in with your phaco tip and try to stay in a center and finish off your phaco from center itself. A meticulous use of left hand will help a lot in managing nucleus. Bury the phaco tip completely to have a firm hold of a nucleus, so the first job becomes easier. You can lift the nucleus a bit and chop from behind if the nucleus is very hard. The posterior plate of a nucleus is the strongest part of nucleus. Once you break this posterior plate, following chopping is much easier. Try to stay in center as much possible, as that will give you a maximum room for manipulations with good visibility. Let the nucleus follow your phaco tip and do not go fishing for nuclear pieces. Try to take cortical material with phaco in position 2 so that it will come easily with a wide bore of a phaco. Taking out a cortical plate with IA tip will be a bit difficult job and can cause unnecessary maneuvering. Here I am using a coaxial IA with a bent tip that helps me in the removal of a subincisional cortical material easily. While doing a cortical wash, fill the bag completely with viscoelastic material, and to start, take out the subincisional cortical material first, followed by rest of a cortical material. Swipe IA handpiece sideways to catch maximum amount of cortical material in aspiration port, which will develop more vacuum, and then pull this chunk in the center. This way you can remove more amount of cortical material in a single go and easily, and this will not leave any tags behind. Again, fill the bag with viscoelastic material. While implantation of a IOL in small pupil, always try to inject the first leading haptic directly into the bag and then guide the trailing haptic of IOL into the bag with the help of left hand instrument. A final visco wash is done as usual. Visco below the IOL can be removed easily by tilting the IOL a bit, but is not a necessary maneuver to perform. Hope you must have noted few tips to manage a small pupil case. Do subscribe to YouTube channel Dr. Pankaj Lande for more such videos. Good day.